Paula, tell me what is your role as the coordinator for the GCPG?
Basically, as the coordinator, I provide the technical assistance for the advisory group or the CPG. Um, what I do is handle all of the logistics, meeting logistics, as well as help them with the strategic planning. The way the community planning process works, the CPG is supposed to be very self-governing, very autonomous. But there are times when the group needs or can utilize the state office resources, including myself, as to provide technical assistance to do some things that they cannot do themselves or would be too costly for them to do themselves. So basically what I make sure is that committee work happens. I set up the conference calls. I am the point of contact between the community members and the state office, and I facilitate the dialogue between the two. I handle the requests on behalf of the group and also funnel down the information from the state office to the community planning group that they need in order to do their jobs or reach their goals that they've set for themselves for the year.
And let me just say, you do that wonderfully, because I want to say thank you.
Thank you.
Because you helped put all this together for the show today. If people don't know, it was you who did it all, and I'm just thankful because this episode would have never gotten launched if it hadn't been for you, and I want to thank you for that today.
And this is truly my pleasure. I worked really hard to make sure that everything came together because we were so excited when we learned that HIV Talk Show would be publicizing our quarterly, because you all have a great following, and this was a prime opportunity for us to get the word out nationwide and even within the state that the community planning group relies on the community, and its mission and its goal is to enhance what the state health department is trying to do, which is to eradicate or reduce the number of HIV transmission in the state of Georgia.
And that's a wonderful goal. Now, what are some things that people need to understand about the GCPG?
One of the things that people need to understand is that this is a very diverse group. There's been some misconception in some communities that you have to be HIV positive in order to apply for membership, and that's not the case. We do encourage community members who are HIV positive to apply for membership, but we also encourage those who are negative or negative but affected by the HIV epidemic to apply. One of the other misconceptions is that you have to work for an AIDS service organization, that you'll be representing the organization that you work for, that you have to have some specialized training or experience in order to assist with the community planning process or become a member, and that's not true either. This group is made up of members from communities who have no experience with HIV, but a passion or a commitment to try to stop the spread, and maybe they're members of a community that has been hit very hard by the HIV and AIDS epidemic, to PhD professionals who have decades of experience in HIV prevention and care. So the group is very diverse, and it takes a mix of the two in order to keep this community planning process flowing and alive and relevant.
Well, I attended my first one when you had it in Atlanta, and I was just amazed at the diversity of people. That when I first came to the GCPG, I thought, well, though this is a very small committee, and I didn't realize just the magnitude of different people and the large number of people that you had at this thing.
Exactly.
And everyone was so nice, and everyone was so passionate about education and teaching, and it was just a wonderful group. I was just so impressed, and when I saw y'all, I said, they have got to be on the show. We've got to spread the word about this group of people.
And the CPG is advocacy at its best, because what you have is you have the state health department who realizes and accepts and operates under the premise that you cannot effectively prevent HIV and AIDS in the state without incorporating the feedback and the perspective of the community who's most greatly impacted by HIV and AIDS. And I think I feel very, very fortunate to work with the state of Georgia, who really values the community's input in the process from beginning to end. And one of the things that people should understand about the community planning process, there really is no beginning and there really is no end. It's constant and it continues to flow as trends change, as funding changes, as the communities that are being most impacted change, then the nature of the process changes. So it is continuous.
And I totally agree, because what I always have to tell people is, unfortunately, we haven't put an end to HIV and AIDS yet.
Right.
So there's a young group of generation coming that don't know. And just because I'm 41, because I know at 41, that's one thing, but someone who's 13
Right.
doesn't know,
Right.
and hasn't seen maybe what I've seen. And so that's what I think that is great with your group, because you're bringing as many people as you can to the table to give input to where we're headed and how to teach and how to educate.
Exactly.
That's great.
One of the things, Alvin, that you touched on, you spoke about youth. Historically, the youth, the population 18 and under, that's a community that has gone largely untapped in terms of participating in the community planning process. Some of the barriers have been, things related to school attendance, because obviously our meetings are during the day. So we are really working to overcome some of those barriers, reach out to the younger communities, because as we know, many of the adults who are diagnosed as HIV positive as young adults likely were infected early in their teen years. So we're really trying to tap the 18 and under community to pull them into the process, because it's a great learning opportunity, as well as we know that there are a number of youth under the age of 18 who are infected perinatally.
Right.
So this is a community that sometimes is overlooked, that we still really want to get their perspective and understanding of their needs and what they can bring to the table in terms of helping us understand the best way to prevent HIV transmission and acquisition amongst this age group.
I agree. And another group is the parents of those young people.
Exactly.
And get those parents involved. And
Exactly.
and I'm sure that they will be more than welcome at the GCPG.
They will. One of the things that is very important for everyone to understand about the Georgia Community Planning Group is their relationship with the State Health Department. It is very much an advocacy and collaborative partnership. There is not one side, whether it be the State Health Department or the Community Planning Group, that has more power, more influence than the other. We really are striving to work collectively for the good of the citizens of the state of Georgia.
Okay, so Twila, I'm so excited about this group. If I'm excited, and I'm sure our viewers are, how do they get involved? How do they get involved in this wonderful organization?
The great thing is that the Georgia Community Planning Group recruits members all year long. We accept applications year-round. Applications that we receive between January and October 31st of each year, they are considered for membership starting January of the new year. If you happen to submit your application later than October 31st of that year, we will still accept your application, but it won't be put into the applicant pool until the next year's recruitment process. But the important thing to keep in mind is that we're always accepting membership applications. And if you would like to be considered for membership or receive more information or an application, it's as easy as contacting me, Twila Marshall, at tmarshall@dhr.state.ga.us, or you can contact me by telephone at 404-463-0389, and I would be more than happy to give you an application or answer any questions that you have about the Georgia Community Planning Group, because we're doing big things for the state of Georgia.
You are doing big things for the state of Georgia. Thank y'all so much for all the work you do, and I really appreciate you coming on the show.
Thank you.
Thank you.